Ms. Vera, thanks for being here today, all the witnesses. I wish I would have been here longer to hear the testimony. From what I've heard, it's been interesting. Ms. Vera, are there any successes at Carolina Health Centers you'd like to showcase in front of this committee, which other areas of the country could benefit from?
Certainly, and you mentioned one in when you introduced me, and that is the short name is LC4, but it's Lawrence County Community Care Center, and I think it's been 10 years since you cut the ribbon on that project. But it was a community hospital that had built a new ER, and they came and asked, what should we do with the old ER? And my question to them was, what % of the patients using the emergency department now are using it for basic primary care, and they don't have a primary care medical home? And the number was shocking. It was like 76%. And so we worked together to build immediately adjacent a primary care medical home where patients can be triaged in the ER. Oftentimes, they're provided treatment because once the medical screening exam is done, it's only a matter of writing a prescription. But if they don't have a medical home, they're sent next door. And then and I would say probably 40% of the patients that are referred to us initially, they established with us, and that number has grown to about 60%. So we've created a primary medical home in a community, by the way, that has one of the highest rates of uninsured people and one of the highest rates of unemployment. So it's really critical. And 340B helps to promote that in two ways. One is we're able to provide those patients with affordable medications. And the other is, as I said earlier, that center has our highest rate of uninsured and underinsured patients. Consequently, we would not be able to cover the cost of keeping that practice open without 340B.
It keeps those patients from going to the higher cost emergency department for their treatment. Once they develop that community care center as their medical home, they can go there versus the ED, and that's great savings for the country.
And if you don't mind my adding, we bend the cost curve in the right direction for the entire healthcare delivery system, because once they're in a medical home, a true patient-centered medical home, we're reducing the use of specialty care, we're reducing inpatient admissions, and certainly we've reduced the use of the ER. So it's not just a savings for that patient or this health center, it's the whole healthcare delivery system.
Well, thank you for that, and I applaud what Lawrence County has done there. I want to shift gears. Mr. Chairman, I'd like to submit for the record an article, Inside the World's Largest AIDS Charities Trouble Move into Homeless Housing, and I'll cover that. I know y'all have to look at it first. We've seen troubling misuse of certain 340B grantees, notably AIDS Healthcare Foundation. Dr. DeGorgio, I want to ask, what should Congress do to prevent abuses like AHFs that prevent others from using 340B for the good?
Yeah, I think we need transparency there. There's clearly bad actors. I know the one of which you speak in California. Transparency showing where these drugs are being purchased, who they're being purchased for, and who's paying it, and then what their revenue is. That should all be public knowledge.
Okay, thank you for that. Anything further we need to do there that you'd like to comment on?
No, thank you.
Okay, thank you. Ms. Veer, the 340B program is a lifeline for safety net providers in the district, as you said. They can invest their 340B savings into making medications more affordable and expanding access to primary care. Can you discuss or elaborate on specific examples of how the 340B program has positively impacted constituents in our community? We talked about LC4, but you have a broad region in the 3rd District. Are there other examples of that?
Oh, absolutely. We've talked about two already, and one is with our early childhood services, the ability to make sure that no family goes without those services because they're not reimbursable by any other source, behavioral health. But I think how it's impacted the constituents in the area is they now have, many of them have pharmacy services as an integrated part of their primary care medical home. In our pharmacy, the pharmacists have access to their medical record. They're able to bring that up. They're able to consult in the practice. So it's really a more complete integration of pharmacy into the primary care medical home.
Thank you for that. My time's expired. I yield back.